they can be prevented and even treated with food, diet, and lifestyle change. The science is clear on this. The science is clear on this. Joe and I were talking a little bit earlier. It's one of the interesting things that one of the questions I always get from patients and students is, well, my doctor said that dietary supplements make for expensive urine. We really don't need these things. Well, it's like, if you ever hear that out of your physician's mouth, you should challenge them to do their scientific research. A lot of these things are just misunderstood, not understood, because of lack of time to understand, appreciate, really dig in to the body of knowledge that is science. It is clear on certain things like these disease reversal possibilities and paradigms. Life expectancy in the U.S. is lower than that of many high-income contemporary countries. Canada, Japan, Sweden, France. Our life expectancy is going down in this country. Does anybody have any ideas why that might be?
How about fast food?
I heard somebody whisper it over here.
Lifestyle.
Stress and lifestyle. Right. Fast-paced, right? This is the age of interconnectivity, right? How many of you carry one? I don't have my cell phone. How many of you have your phone? You know, I mean, it didn't used to be like that. You had to go across the street and use the neighbor's phone at times, right? Environmental toxicities and personal toxic burdens continue to grow. This is something that's really evolving in contemporary Western medicine. We're really starting to notice that, surprise, environmental toxicities actually do affect your health, and profoundly. So here's our path to solutions. We need to get back to our roots. We need to respect our elders and respect our traditions. The wisdom of our elders and traditions can at least be a guiding light in our ways forward. And this is what we call healing across cultures, learning from traditions. So to promote health, we must strive to understand it from fundamental perspectives. And what we do is go to the roots of health and healthcare and ask a multitude of healers from varied cultures. We ask them, our elders, their secrets for long life, the traditional healers and elders, the world over. And in fact, that's what we did for the past 7 years. Traveled around the world. And we didn't ask just anybody. We asked the elders' elders. Okay? We interviewed 37 elders, over half of which were over 100 years old. The oldest respondent in our studies was 106. Right? And they all self-identified as being community elders and healers that people would come to for healing knowledge and wisdom. All important things, right? So these are some of my healers and elders that we work with. And you can see their pharmacopoeia is from the forest. Right? It's from the forest. And they too start important endeavors off ceremonially. Before they go into the forest to collect their medicinal plants, they conduct ritual and ceremony, asking permission of the earth and the cosmos. Right? Appalachian and Native American healers and healing. This is my own tradition. I'm a traditional Appalachian root doctor. I grew up on a self-sustaining farm in rural Appalachia in Sweet Valley, Pennsylvania. I learned traditional healing. Right? I'm native. I'm also a bunch of other things. I think one of the important things that I try to pass on to my children, my students, my patients, my colleagues, everybody around me, is that we must reinvigorate our connection to our roots in the world and the earth. This is something that we could go out into the forest today and I could show you plants that we're selling on the shelves now, right? Is there anybody here that can tell me what this plant is? Nope. I'll give you a clue. We've been exporting this plant to China from Appalachia since the 1700s.
Ginger?
I heard the right one.
Ginseng.
Ginseng. There you go. Panax quinquefolius. This is our native plant. As an Appalachian root doctor, I grew up sanging in the mountains. That's how we would call it. Right? Anybody know what this one is? I know my 6-year-old daughter knows. That's golden seal. Golden seal. All the way to India, Indian healers and healing, beautiful traditions of food and Buddhist medicine and Charodara. We reinforced our model, mind, body, and spirit, in the context of healthful environmental surroundings. They all understand this. It's all inextricably intertwined with who they are. However, the youngsters aren't getting it all, right? You might be thinking, well, who cares about traditional healing and traditions and all this stuff? Well, I'm going to tell you a quick story. When I was a medical student at the Cleveland Clinic, I gave a talk on ethnobotany, rainforest plants, all this kind of stuff, and it was an impressive showing for a medical student. You know, I'm standing there and there's all the white coats and some of the big name docs came in. Just a great experience to be a student there. I met a lot of my mentors there, Dr. Paul Esselstein, Vlad Galyevich, Joan Fox. These are people that really helped me along my path. But anyway, so I'm giving this talk. And one of the doctors, he was in the front row, gets up and says, I don't believe in herbs, and he starts to walk out. And I'm thinking to myself, why'd you come, man? You know, said it was about herbs. But I stopped him. I said, excuse me, you know, obviously you don't have to stay, but let me ask you one question. He turned around. I said, when's the last time you prescribed morphine for a patient? And he laughed. His colleagues laughed. They all laughed, and he came back and sat down. For those of you that don't know, morphine comes from a plant. He became one of our greatest supporters, that doc. So to me, it speaks volumes in the sense that people are ready to learn. They're willing to learn. They will learn. More than 80% of the world's population currently relies on traditional healing modalities of herbs for primary health care. So they go to the traditional healers, the elders, the granny healers. Even here in Cleveland, we have, you know, all kinds of traditional healers. The granny healers in Cleveland or the Appalachian root doctors. People have their traditions, right? They go to grandma sometimes, right? This is how it works. Greater than 1 in every 4 modern-day medical drugs come from traditional healing knowledge. Comes from plants, right? Most of the most powerful pain control medications come from plants. Most of the most powerful cardiac glycosides, heart drugs, come from plants, right? Atropine, scopolamine, you name it. Medicine is possible because of traditional healing knowledge. Millennia of shared learning in the natural world, right? The revenues are staggering. In 2000, the United Nations was estimating that approximately 60 billion on the world market was estimated to be result from traditional healing knowledge. If only a percentage of that went back to the rainforests and the traditions for that knowledge. And they're not just little things either, right? This is nature, medicine, and we're talking about important drugs like Taxol that's helping fight in the forefront of breast cancer, and vincristine and vinblastine, which help reduce the morbidity and mortality of childhood leukemia from in the 90s to like under 10% from traditional healing knowledge. All too often, we don't make that connection. People don't realize these things, even physicians. So herbs work, right? All right. Let's talk about some of the secrets of long life, according to the traditional healers and elders with whom we work. They have some basic philosophical underpinnings that we'll talk about first. Adding life to years rather than adding years to life is the goal to which most strive. They have a whole slew of strategies for this. But health and balance of the mind, the body, and the spirit in the context of healthful environmental surroundings is essential to the well-being, right? And intimacy with nature is profoundly important in all of these traditions. So the advice for the outside world that they had can be basically grouped into two main categories, the lifestyle and diet. And the lifestyle includes some of those aforementioned philosophical underpinnings that I just mentioned. But they all involve some component of mind, body, spirit, environmental interrelation. So here we are again. Mind, body, spirit, environment, those are false dichotomies, right? It's a complex. It's not just the health of the mind, or the health of the body, or the health of the spirit. It's all inextricably intertwined. So for lifestyle, here's what they have to say. Advice for the outside world. Be present and mindful, even if for only a few moments daily. See, this is one of the major underpinnings of our declining life expectancy in the Western world, right? Stress-based illness. Stress-based illness. In fact, so much so that recent science now in mindfulness in health is showing that by being mindful, one can control gene expression, right? Which genes are being turned on and off. We all know how important epigenetics and genetics are in health, right? All too often, they would say, people nowadays spend most of their time either in the past or in the future thinking about, oh, this is how it used to be, or this is how it's going to be. You exhaust all of your efforts trying to either make amends for the way it was or make plans for the way it needs to be, lose sight of the present. That mindfulness, and stress out about all of these things. Raise the cortisol levels, and the pathologic ramifications are evident. The power of the mind. So they suggest being mindful for a few moments daily. And as a professor at Cleveland State, I can tell you that I have a number of students that basically, students, they freak out with the exams and anxiety and all this other kind of stuff. So my colleagues and I decided to test this, and we last fall gathered a cohort of students and had divided them into control and meditation group. And we had them do meditation and be mindful for a few minutes every morning. We had a local energy worker come in and teach them how to be mindful. And they did it for 5 or 10 minutes every morning. We assessed their anxiety levels by this instrument called a Hamilton Anxiety Survey. And what we showed is that the group that was mindful for 5 or 10 minutes a day, their stress, their anxiety level was decreased by half by the end of the semester. By half. Very statistically significant p-value too. So it works. It's not just, some hokey-pokey meditation stuff. We must be in the present for health.